Okay, so we're looking at the same right shoulder here, but this time we have muscles on the model. At the end of the last video, we talked about all the fossas and all the relevant bony anatomy that serves as the insertion point and origins for a lot of these muscles here. So if we turn this person, so right now we would be looking straight at their shoulder from the side of them, and now we'd be looking at their back. Where we finished up last time was talking about this fossa. This is where the supraspinatus muscle sits. This is a pretty relevant muscle in your rotator cuffs because it's actually the most commonly injured rotator cuff muscle. So you see that it comes through here and it connects on the top of the greater tuberosity. If we go just inferior to that, we'll find the infraspinatus muscle, which sits in this fossa on the back of your scapula, and it comes around and just a little bit lower and a little bit posterior to the supraspinatus is where the infraspinatus inserts. And finally, not to be forgotten, is the Teres Minor, which is a little bit beneath the infraspinatus, and it also originates here on the scapula, and it will insert even a little bit lower than the infraspinatus into that same greater tuberosity area. If we go to the front here, we can see the very last rotator cuff muscle, which is the subscapularis, which if you shove a thumb into your armpit onto your scapula, you'll feel that muscle, and it's a pretty tender area. And that actually inserts right here on the anterior portion into the lesser tuberosity. All right, so now we're looking at this model, looking down on it from above. If you remember this little process right here from the last video, it's known as the Coracoid Process. And these are three little ligaments that attach from the Coracoid Process, all known as coracoclavicular ligaments. But going from lateral to medial, they actually have individual names. The most lateral is the coracoacromial ligament, going from the coracoid to the acromion. Working our way in, we have the trapezoid ligament, and finally, the conoid ligament. Now, if we go a little bit more superior, we're going to talk about the AC ligament, which we already talked about a little bit. The AC ligament, otherwise known as the acromial clavicular ligament, attaching the acromion process to the clavicle. Alrighty, so the last thing I want to talk about today is actually a muscle that we cannot see on this model, your trapezius muscle. And the reason I want to talk about the trapezius muscle, or what a lot of people would just call the traps, is because it's actually a pretty big cause for a lot of neck pain and a lot of cervicogenic headaches. So your trapezius muscle has pretty big origin points or attachments up on your occiput and also in a couple of your vertebrae. But pertaining to the model on my hand, it also has attachments on this lateral third of the clavicle, the spine of the scapula, and this superior part of the scapula, all those points that are marked in blue. So if you ever have pain or tenderness in those areas, it's a pretty good indicator that your trapezius muscle might need stretched or strengthened.